Hi, my name is Azithromycin. I'm a student nurse in UC Manitoba. Today we're going to be demonstrating IV mini bag insertion. So we have our patient here. His name is Watson William. So we're going to be treating for him. He has cellulitis. So now what we're going to do is we're just going to compare. So physician's order NMR has already been compared. So they're already being transcribed properly. So we know that's good. And we grabbed our medication from the Pixis machine, and we're going to start our first check now. So we wash our hands, grab our medication. So this is the right medication. It's Watson William. That's the medication, and it's basically the patient. So Watson William is the patient, and the date of birth is 14 June 1983. They're allergic to shellfish, so we're going to take note of that. Azithromycin is the medication. It's 400 milligrams. 400. So Azithromycin, 400 milligrams. That's how much we need, and there's 500 milligrams in the vial. We're going to take out. It's an IV medication. It's given daily, and we see that it's not been given for today, so we're going to give it today. Okay. And we see this bottle is not expired. It's a new bottle. It's intact, so that's all good. Now we're just going to look over this medication with the parental drug monograph. So we have here the medication Azithromycin, or Azithromycin, same one. It's an antibiotic, and the reason we're treating this medication is because we're treating for his cellulitis. And we see that it's it can be administered by a student nurse, so I can administer it. The usual dose is 500 milligrams IV daily, within that range. So we're good. We're only giving 400, and the maximum single dose is 500 milligrams. Okay, and the maximum daily dose is 500. So we're under that range. So we're reconstituting. It says we're reconstituting 4.8 mLs of sterile water, and we have a sterile. So we're going to inject that in, giving a final volume of 5 mLs, and a final concentration of 100 milligram per ml. And then for the IV intermittent, we're diluting with a 250 to a 500 ml normal saline bag. And we checked previously that we're going to be using a 250 ml normal saline. We checked previously that the primary is actually running on normal saline. So normal saline, they're both compatible with each other. They're isotonic, not going to cause any changes to the blood. So we're going to that's the reason we're going to be using normal saline, and we're administering over an hour. So the reason we're administering over an hour is because we want to not administer too quickly to the patient, so they can cause vein irritation. So I'm also going to monitor for adverse effects and making sure that the medication is working. So for the rate, so the rate is 2 milligram per, or 500 milligram in 250 ml over an hour. So we're going to be doing it over an hour, and we see that it's compatible with normal saline, and that's good because our medication, we know it's compatible with normal saline, and it's the primary source we're running in normal saline. Some potential hazards we're going to look for is rash and pruritus and nausea and vomiting. So we're just going to assess for those as well. Okay, so we're just going to wash our hands, prepare our medication. So we're going to get is our 10 ml syringe, and we're going to get our sterile water, and essentially this is sterile water, and it's a new bottle. It's not expired, it's intact, it's all good. And we're just going to prepare a syringe and a blunt fill using sterile technique. And it says we need to pull out we're going to be pulling out here. It says 4.8 mLs of sterile water, so we're going to aseptically attach this out, and we're going to pull down our syringe for 4.8 mLs of sterile water, of the air, and we're just going to swab this for 30 seconds. So swab for 30 seconds, and I dry for 15. The purpose is demo, we're not going to swab for 30 seconds, so that's already good. And we're just going to swab this one as well. We're going to use a new alcohol swab when we swab it, but the purpose of demo, we're just going to do this. So 30 seconds and 15. Okay, so now we have injecting our 4.8 mLs of air into this to draw out the medication. We already swabbed it. It's sterile. And now we're just going to now. Okay, so we're just going to draw a bit of access so we can get rid of the air bubbles. Okay, so we're going to use our syringe here. I'm going to draw back, knock the air bubbles out. And we're just going to prime this over the med waste. So we have to have a med waste here, and we're priming it. Okay, there's 4.8 mLs. Okay, and we're just going to now, so there's 4.8 mLs of sterile water in there, and we're just going to now swab this for 30 seconds, let it dry for 15, and then we're just going to inject that in to the thing. We're injecting this in to the medication to reconstitute it. So we're letting the air draw back. So we're just gonna now recap this. Now we're gonna reconstitute this. So we're just gonna mix it well, and we see that there's no sediment in there and there's no air bubbles. So we're just going to now do it. So now just going to get the medication out. So we need 5 ml. So I'm going to rerun calculations. So we need that for the 400 milligram dose. We need to pull out 4 ml, and we show our calculations 4 ml, and that's how much we're going to draw out. So we're just going to now put 4 ml in our syringe, inject the 4 ml in, and we're just going to now swab it again for 30 seconds. Let it dry 15 with the new alcohol swab. Okay. Inject the air in. It's already sterile, so we swabbed it. Okay. And we're going to draw the dose of the 4 ml as ordered. We're going to just draw out a bit of excess because I'm going to get rid of the air bubbles. And for the purpose of this demo, it's not the real medication, so we might not get the real actual dose, but the actual dose for this would be 5 ml from the bottle. And we're drawing out 4 ml for the ordered dose. So we're just gonna knock the air bubbles out. We're doing this over the med waste. So we get 4 ml. Okay, and we're showing that there's 4 ml in here. Showing the 4 ml. Okay, and now we're just going to do our second check. So we have our medication here. So we have patient's Watson William. Medication is Azithromycin. It's 400 milligrams, 500 milligrams in this vial. We're going to pull out 400 milligrams. So 400 milligrams here. The ordered dose is 4 ml, and we check there's 4 ml in there, and we calculate that as per calculations we need to draw 4 ml, and it's IV medication. This is IV. It's IV route. It's given daily. Has not been given today, so we're going to give that medication now. So now we're just going to pull out our mini bag. So this is a new mini bag. It's 250 ml normal saline. We checked it's compatible, and it's a new mini bag. It's intact. It's not expired, so it's all good. So what we're going to do is we're just going to swab the port. So we're using our new alcohol swab, swabbing it for 30 seconds, letting it dry for 15. Okay, and then we're just going to now inject our medication, keeping it sterile because we have to keep this sterile. So we're just injecting in the center, making sure not to perforate the bag. Injecting that now. Okay, and we're going to dispose of this in the sharps container, and we dispose of these vials as well in the med waste and the sterile water in the garbage. And we're just going to now gently mix the medication so it gets distributed out. So it's all good. And we're just going to attach our label to the. I'm going to attach our label on there. Okay, so we've done that, and now we see that this medication, so we're just going to go over it. So we have Watson William, Azithromycin 400 milligrams and 4 ml in here. It's 250 ml in the here, but we have a total of 254 ml because that's how much we injected 4 ml of medication there. So a total of 254 ml in the bag. So we've done that. Now we're just going to get our secondary medication set. It's a new set. It's not expired. It's intact. It's all good. And we're grabbing our pen, our calculations, and we're grabbing our MAR, and we're just going to head to the bedside. And okay, so grab that, and we're also grabbing our alcohol swab as well. So we're just gonna wash our hands before we leave, and we're gonna do a quick safety check. See, there's no tripping hazard or anything like that. Patients are not in stress. Call button around. Is in lowest position. Enter in. Introduce yourselves. Washing hands before you touch the patient. So hi, my name is Salpura. I'm a student nurse at the University of Manitoba. Can I just we're just gonna be giving your morning medication. So can I just check your armband to see if the right patients are washing hands before you touch? So we're actually introduce yourself. So hi, my name is Salpura. I'm a student nurse at the University of Manitoba. Can I so we're gonna give you your morning medication. So I'm just checking your armband to see if the right patient. We're checking the armband here. So we see the Watson William, over there, date of birth, perfect, and you have allergies to selfish. Can I get you to state your name and date of birth? Okay, and do you have any allergies to selfish? That's what it says here, perfect. So now we're just going to assess the IV site, and we see that it's normal saline. They're both compatible with our mini bag, so that's good. And we see that the last nurses put their name, date, initials on there, and time. We know this bag not expired. Same with the tubing. They're labeled as well, so it's not expired. So, and we're checking just the IV site. See, there's no kinks or other bubbles. It's all good. And we're checking the pump. It's at the for the primary set at that rate. So it's 25 mile an hour. So that's good. And you see, we're checking the IV site and seeing the patient's. There's no signs of infiltration, perioditis, or anything like that. So, are you experiencing pain in the site? No, the patient denied pain. So that's good. We're just gonna wash our hands. And we're gonna do a third check. So we're doing our third check with here. So we have Watson William, medication Azithromycin, 400 milligrams, 4 ml of medication injecting in, given a total of 254 ml in the bag. It's IV medication, it's given IV, and has not been given today, so we're gonna give that medication today, okay? So we're just gonna do some patient education. So Mr. Watson, this medication is called Azithromycin. It's an antibiotic. So the reason we're giving this medication is to treat for your cellulitis. So some side effects with this medication you might experience is a rash or nausea and vomiting. If you are experiencing any, just let us know with a call bell. So the patient has the right to refuse the medication. So we're going to basically ask the patient for consent. The patient consented to give me the medication, so I'm going to give the medication. Okay. The patient didn't refuse it. So we're just going to prepare the medication. So what we're going to do first is open up our our secondary medication set. Okay, and I'm just gonna bring this a bit forward here. So we're just gonna lower our primary here. Okay, and then we're just going to now we lowered our primary. Now we're just going to attach our mini bag. So we're just going to grab our secondary. So we're swabbing this port. So we're going to be attaching it to the port that's above the pump here, or just above the pump. So this port here, we're swabbing it for 30 seconds. So we're using our alcohol swab. It's a new alcohol swab, swabbing for 30 seconds, letting it dry for 15. Okay, and then we're making sure that's sterile. So it's still sterile right there. So we're just going to attach our port, making sure this is clamped. So we're attaching our port aseptically here, making sure it's still sterile, it's not contaminated. Okay, attaching our port. It's all good. Now we're just going to attach our mini bag. So attaching our mini bag, making this sterile here. Okay. So we attached our tubing. So now we're going to back prime. So the reason we're back priming is basically to get rid of the air bubbles. So we're just going to back prime, let it back prime here. So we're just letting it back prime and making sure there's about 1/3 vacation. Stop back priming. So the reason we're back so we're back priming now, so it's good. And so the reason we're back priming is to get rid of the air bubbles, so that there's no air bubbles in the tubing. Okay, so it's about 1/3 full, so that's how much we needed. So we're just gonna clamp this up, and we're gonna set a rate. So the rate that we calculated here is 200. So we have a rate here. So we're going to secondary, and we're setting our volume for 254 mLs, and then we're setting the rate for 254 mLs. Clear that. So 254. So then we're just gonna confirm our start, and we're gonna put our call back on there. So it's not infusing, it's all good. So Mr. Jack, medication is infusing. If you are experiencing any side effects, let us know with a call bell. To make sure to come back and with the call bell, with a call back, to make sure this is pumped, to make sure this faucet is 15 ml, so that to make sure faucet with 15 ml, and so that the patient gets the full medication dose. We're flushing with the pump. We're going to set the 15 ml on there, and we'll make sure that we're going to document the ins and outs sheet, and we're going to document on our MAR that we give the medication. We documented that, our name, date, time, initials, and designation. So then that. Now we're just going to make sure all the lines are unclamped. So we're clamping this, and we're checking there's 3 drops on there. There's 3 drops, perfect. We're switching lines, all good. IV sides, everything's open, and we're just going to wash our hands. Make sure to do exit safety check. Make sure all lines are connected, everything good. If you're experiencing any side effects, just let us know with a call bell there to assess you. And put a call bell there, but there's low vision. Patient's not fine, so we're just going to wash our hands and leave. Is it good?
Yeah.
How many times?
14.
14?
Are you done?
Oh, is there more time?
You have 1 more minute.
Okay, so I'm going to make sure that the patient's all comfortable, call bell's nearby, bed in lowest position, and make sure everything's all good. And just going to make a right IPN if necessary. And we said after we leave the room, we're going to make sure to write it on the fluid ins and out sheet, okay? So you wash your hands, and make sure everything's all good with the lines. Patient's IV site's all no irritation, so good. So we're just going to leave the room now. Okay.